Hi, my name is Sarah Alderat. Today, with Jada, Angeles, and Stephanie, we will be presenting about different topics regarding social and moral development. Our mission statement is that our group will be looking at what influences the formation and growth of an individual's ethics and morals according to Kohlberg's theory of moral development. We will observe systemic barriers and inequities in the United States that encroach on individuals' quality of life. Our goal is to empower the general public to work toward equitable change for all groups of United States society. Change begins with education, advocacy, and the formation of strong moral foundations.
Lawrence Kohlberg is a psychologist best known for his work in moral development theory. His model, consisting of 6 stages categorized into 3 levels, provides a comprehensive framework for understanding how individuals evolve in their moral reasoning from early childhood to adulthood. Kohlberg's contributions have left a lasting imprint in the fields of psychology and educations, offering valuable insights into the intricacies of ethical decision making and moral growth. Here is a pyramid chart of Kohlberg's theory of moral development. Kohlberg's 6 stages are divided into 3 levels, which is level 1, pre conventional morality, level 2, conventional morality, and level 3, post conventional morality. In level 1, it consists of stage 1 and 2, which is early childhood disobedience, avoiding punishment, internalizes punishment as being bad. Stage 2, seeking reward, internalizes reward as being good. Level 2 consists of stage 3 and 4. Stage 3 being social approval, believes they are good if others say they are good. Stage 4, reverence of societal law and structure, believed to be good must follow and preserve societal expectations. This is around middle childhood. And level 3, post conventional morality, is stage 5 and 6. Stage 5 being individual rights and differences, recognizes laws serve some and disadvantage others. Stage 6, global and abstract, considers whole instead of individual, will follow ethical conscience even if it means breaking the laws. Not everyone will reach level 3, stage 5, and stage 6. Higher morality development does not necessarily coincide with moral action. However, it is theorized that moral action will more likely occur at higher morality levels.
All right, since there's been more background on the 6 stages of Kohlberg's theory, we will be seeing the opioid crisis through the lens of Kohlberg's theory. The first is the pre-conventional level, which is stage 1. In the context of the opioid crisis, people may perceive those battling with addiction as deserving the punishment of their choices. This simplistic view may lack empathy and understanding of the factors contributing to addiction. So, stage 2, individualism and exchange. The opioid crisis may be viewed as a problem affecting individuals who made poor choices, and the empathy may be limited to those perceived as victims of the circumstance. And then we have the conventional level with stage 3, the interpersonal relationships. In the context of the opioid crisis, social judgment may play a significant role. Society might stigmatize those affected and avoid the development of empathy and compassionate response to those battling addiction. And then we have stage 4, maintaining social order. Responses to the opioid crisis may focus on law enforcement and punishment instead of addressing the underlying issues of the opioid crisis. So now we are in the post-conventional area with stage 5, the social contract and individual rights. Concerns about the opioid crisis may shift towards addressing systematic issues such as healthcare, access, education, and social support. And in stage 6, the universal principles, In the context of the opioid crisis, responses may involve advocating for a systematic change, emphasizing on rehab over punishment, and addressing the factors that can cause addiction. So, the opioid crisis and Kohlberg's theory. The opioid crisis can impact social and moral development by influencing individuals' perspectives on responsibility, empathy, and societal responses. Efforts to combat the opioid crisis may involve not only addressing addiction, but also promoting empathy and systemic change. Advocacy for policies that prioritize rehabilitation, mental health support, and addressing the socioeconomic factors contributing to addiction aligns with the post-conventional stages of Kohlberg's theory, for example, education and awareness campaigns. The connection to my career path. As a future physician assistant specializing in mental health, I would raise advocacy for the misuse of drugs, educating about substance abuse. I will target the younger community and let them know about the factors that come with abusing these drugs, provide social support services to my patients as well as the families of my patients, because it's vital for physician's assistants to provide comprehensive care, addressing not only the medical aspects, but also the broader contextual and social factors contributing to opioid misuse.
Okay, I will now be sharing about systemic inequities in the United States. This is tying back to our mission statement. So, culture affects individuals and individuals' views, beliefs, and values. In the United States, the cultural value of rugged individualism reinforces white supremacy by belittling inequities experienced by marginalized people. Health matters are individualized, and it is suggested that an individual is in charge of their own health and destiny, not taking into account the long existence of systemic racism and classism that has created barriers toward equitable healthcare. And there's more than racism and classism. There's ableism, ageism, but we're going to focus on racism and classism for now. So rugged individualism averts the idea of healthcare as a human right and forestalls universal health coverage, which would be a start toward equitable healthcare. Colonization, structural racism, and classism impact social determinants of health by causing inequality in employment, education systems, housing and transportation, quality healthcare, exposure to environmental hazards, and access to healthy food. All of this was sourced from a paper by Watson and other authors made in 2020 talking about the COVID-19 epidemic and seeing systemic inequities in healthcare. The social determinants of health are, which I mentioned earlier, are environmental factors that contribute to a person's health, well-being, and quality of life. You can find a lot of information on the social determinants of health on Healthy People 2030. As I have a little example over here of what the social determinants of health are: education, access, and quality, healthcare access and quality, neighborhood and built environment, social and community context, and economic stability. For someone to have a healthy, happy life or a good quality of life, those areas need to be addressed. So now I talk about therapy. So I don't know if people would consider therapy to be vital toward equitable and systemic change, but I believe it is. And I might be a bit biased since that is eventually what I would like to become as a therapist. But anyways, therapists need to see the larger picture. Therapists can tend to individualize issues, but there are interconnecting issues of inequities and collective trauma that affect an individual and community. That needs to be addressed in therapy, not just the individual. the whole. Therapists should acknowledge self-bias and lack of experience. That doesn't mean lack of experience that they haven't gone through school, but maybe they haven't, you're not going to experience what everyone else does. You might, like, I'm a white woman, I'm not going to know the experiences of a Black woman. So listening with empathy, humility, and attentiveness. Listen with curiosity and a learner's mindset to unfamiliar realities. Recognize that therapists play a part in systemic racism and discrimination. To be part of change, a therapist must first be aware of the tendency to perpetrate systemic inequities and what they rethink and remodel their ethics of care. Therapists can offer a safe environment to discuss discrimination and challenge old stereotypes held by an individual, which is how we impact equitable change. Therapists have the ability to help a person at different life stages to grow their ethics and morals according to Kohlberg's 6 stages of moral development. Also, if you'd like to read more about family therapists and how they can participate in equitable change and may unknowingly be perpetrating or creating more systemic inequities or just partaking in them, the paper by Watson and other authors is a great resource.
Relating my career path to systemic barriers and inequities as a social worker, I would play a vital role in addressing social problems by recognizing and tackling root causes, particularly systemic inequalities. Social workers' focus is on empowering individuals and communities to advocate for change, challenging unjust social structures. Services provided include counseling, case management, and advocacy, along with connecting people to essential resources like food, housing, and transportation. Social workers actively advocate for social justice, working towards breaking down barriers and promoting equity. Through influencing policy, community organizing, and addressing individual needs, social workers contribute significantly to positive change and improved well-being globally. Child abuse and mental health are closely linked to systemic inequities, creating a cycle of vulnerability that unfairly impacts underserved communities. Economic disparities and limited access to quality education and healthcare contribute to stressful environments where families lack essential resources. Social workers intervene to break this cycle by advocating for policy changes and directly assisting families in need. They tackle the root causes of systemic inequities, advocating for enhanced mental health services, affordable childcare, and comprehensive support systems.
Hello. As a youth correctional counselor, I'll be working with people of many cultural, ethnic backgrounds, and moral outlooks. Communicate with youth, whether individually or in groups. I will point out problems and facilitate cognitive behavioral interventions and using other evidence-based practices. I will support these children and teenagers in this time and reduce the risk of reoffending. I will analyze the youth's needs and requirements and develop treatment programs. I will assist the youth in building positive social, emotional thinking, communication skills, and behaviors. Mothers in prison can cause a huge impact to their families and children's life. Women are not able to parent their children and nurture them because they are behind bars. It can affect a child negatively, like problems at school, psychological, and behaviorally. These children, unfortunately, are likely to offend as well. We need to work on strengthening parent-child relationships and encourage guide mothers to a stable, mentally stable, good life outside of prison. I will most likely be able to provide these women with education, jobs, programs, and resources to help them out.
So in conclusion, how we could apply this to our personal lives, individuals may apply Kohlberg stages by reflecting on their ethical decision-making, implementing fairness and justice, and we may just actively look for chances in our daily lives to engage with people, to listen with an open mind and open heart, to not only listen to response, but listen to hear each other out and establish a safe space in our social circles and communities. Applying to our professional life, applying these stages can enhance moral reasoning, making thoughtful decisions, trying to do the right thing in the workplace, also by making sure our companies are supporting mentorship programs and inclusive policies, moral decision making. Holding these values can create a healthy workplace. So thanks for hanging in with us, and I hope you guys learned a lot about social and moral development.
Thank you.
Thank you. And this is our bibliography. So if you want to look up any of the resources we used, here you are. All right. Thank you, everyone.